Stillwater's Morning Scramble at 8:14. Glad to have you here and glad to have the mayor in, Will Joyce. Good to
morning,
see you.
Steve. How
Good
are
to see
you?
you last week.
I
So
know.
seems like we've got a lot to catch up on, I guess, right?
Well, there's a few things happening around the city and the state and the nation.
Yeah. This last weekend, and I didn't leave town. Usually 4th of July, I do leave town. I did not this time. And I was I was actually ready to come back to work. Right? For one, I have a pretty good job.
Yeah.
And so, I'm not doing the work that I saw people at 6:15 in the morning. Hats off, they were working on Main Street still.
Uh-huh.
They were out there working their tail off before it got totally
Too
hot.
yeah.
And so that's work. So when I come back here, but it is a little different. Our regimen of getting away and stuff, and so I really haven't. You did, I think.
We did, yeah. So my wife and I celebrated our 20th wedding anniversary here last week, and we're able to get a few days away, and we actually drove out to New Mexico and found rented a house out in the middle of nowhere, so we wouldn't have to mess with people or go walk around tourist towns or anything like that. We just went and took a couple days away, which was really nice to be able to do, especially in a state like New Mexico where they have a mask law. So when we did have to go to the grocery store, when did pick up, everybody was wearing a mask. So.
Well, and you're watching all this stuff so much more now.
Yeah.
Were you able to? Because one of the things about leaving town or whatever is hopefully you leave your troubles behind for 4 days or however long you're gone.
Yeah.
Are you able to do that?
No. Is anybody? I mean, I don't. No. I mean, it's really difficult at any point. I mean, even when it's not this situation, I mean, I have a job and, I'm the only person at my office that does what I do. So it's tough to really step out of even the day-to-day work and sort of go, oh yeah, I'm just not going to worry about anything, because as soon as you get back, it's
waiting for you.
It's waiting for you. It's not gone anywhere. So I think that's a really difficult thing, and I don't know if that's that we could have a whole big societal discussion about how that works, because then I think it's tough for all of us to kind of disconnect and really take time away to recharge or that sort of thing. And I think that's tough on us. I think that's part of the problem right now with this whole pandemic issue, is that it's just kind of been, all of us have been on for months, and under a different amount of strain and stress just in our daily lives, trying to, worrying about, this legitimate health concern. And I think you see that just around us in people that there's a lot of folks who have been under a differing amount of stress and strain in their lives the last few months, and I think it's starting to wear on all of us.
I mentioned to Michelle earlier that the one thing I've seen a few say was, I wish I'd have done this different. And I admire that when they say that, because we don't have a blueprint for this. No. Nobody does. And so when I see whether it's the governor of Texas or whatever saying, if I was to do anything different, I'd like to go and get a redo on the bars, is what he said. And so to admit, okay, now that we know how that turned out, or is what it's become, I would do things different. And I think you even said that earlier. So
sure.
You can look back and go, because nobody knows. I mean,
No.
you simply don't know.
You really don't. And anybody who thinks they've made all the right decisions all along during this thing is wrong, because clearly I don't think that's the case for anybody. Whether you're talking about public health officials or governors or presidents or mayors or whoever, I think everybody has just sort of walked fairly, gingerly through this whole process and trying to figure out what to do. And no, I mean, absolutely, I don't think that anybody can stand up and say they've made all the right decisions at every point.
But the only way you could have a real regret, I would think, is if it wasn't using the information the best that you had at that time. And you've done that. So,
I mean, we've tried.
Yeah.
I mean, that's
all you can do right now.
Yeah, I mean, what we've tried to figure out what's the best thing to do based on the information we have. But yeah, I mean, if you go back and look and go, well, the decisions we made in March, based on the situation then and what kind of the concerns were, are they the same we would have made now with the benefit of hindsight? Probably not. But they were the best decisions we could make at the time, given the information we had.
And we're seeing governors in some states reverse what they had done before, in the fact that not just with the bars or whatever, but about local control or whatever. At one time they'd relinquish this, and then they took it back, and then they relinquish it again. I think Arkansas.
I heard you talking about that with Michelle this morning, about Arkansas taking it away and then giving it back. And honestly, to me, that feels a little bit more like the governor looking for someone else to have to shoulder some of the burden because he doesn't want to make. They haven't made a statewide order, right? And so
No,
they're
they
saying,
have not.
oh, okay, well, if you as a city want to do it, you can go ahead and do it,
Right?
Because they don't want to make that.
But early on, the way I understood, he took it away from the city and said, "No, I want,"
which is also silly, but at the same time, I mean, I think part of I've had this conversation a lot because I'm a strong proponent of local control in many situations, and that we as a city should have the ability to make decisions for ourselves that we feel are in the best interest of our community in situations where they're unique, right? Yeah. Where what happens in Stillwater is different than what happens in Oklahoma City or Tulsa or Norman or Lawton or wherever. And so we should have the ability to make those decisions. Now that it looks different in different scenarios, right? When you're talking about a global pandemic and a statewide, infection of disease, you start to talk a little bit about, well, yes, we want to have local control, but we also need regulations in place that apply broadly to the entire state to handle a situation that is not necessarily just a local issue, right? I mean, it's different here than it is in Oklahoma City, and it's different here than it is in, Buffalo, Oklahoma, right? But at the same time, there's a lot more similarities that need to be handled from a larger, higher up perspective.
Well, and it's easy when we're not responsible to say, this is what I'd like to do. But you made the point, and I hadn't really thought of it like that, but if Oklahoma City has one set of rules, and you've tightened up yours on the bars and the restaurants here, and they did not, then if I want to go to Bricktown, I can go to Bricktown.
Sure.
If I say, we need to get out of the house, let's go to Bricktown, then I go to Bricktown, and I bring whatever came in Bricktown back here. And that's one of the reasons why I mentioned where I grew up, the county has 20 right now.
Yeah.
In the whole county. So I'm not going to go right now because I don't want to be. We've seen what happened here with the spikes, and I guess a lot of those were from people that left and then they come back and now they're out and social and they bring it in basically. Mm-hmm. They're a carrier, and I don't know that I'm not a carrier. Sure. I just know I'm in a county of over 400 positives total. To go to a county where there's hardly any seems irresponsible.
Yeah, I mean,
well, especially if you have vulnerable people in your own house.
And I think certainly the most cautious course of action there would be to say, well, it's not worth it, right? Unless there's a very compelling reason for me to go do that. There would be a concern that you're going from a rate of higher infection to lower. I mean, that's why you're seeing states like New York right now that said basically if you travel to New York from Florida or Texas or some of these places where they've got really big spikes going on, that you have to self-quarantine when you get here. And we were doing that. Oklahoma, actually, I'm not even sure of the current status of the governor's order on that. But back in April, we had a statewide order that said if you came in from New York or Seattle or certain areas where they were higher at that same time, you were supposed to self-quarantine here in Oklahoma if you came from a higher rate of infection. And that's all a completely reasonable public health sort of a rule to put in place. And I think we all have to have that consideration. Again, I think the most difficult part of this whole thing has been trying to get our head around what, making decisions based on the good of the larger population and not just on my own personal health. Because I do have to make decisions based on my own personal health, right? If I am vulnerable, if I am, at higher risk for developing serious complications from COVID-19, I'm going to be personally much more careful about trying not to get it. Right, than someone else who may not be, as concerned about the complications. So I have that personal health responsibility. I want to keep myself from getting it. But at the same time, all of us have the personal responsibility to keep others from getting it and from spreading it to someone else without knowing we have it, which is what we're seeing in a lot of the spread now, is that there's a lot of mild symptomatic or asymptomatic cases that are spreading it around because people aren't taking the precautions to protect their neighbors.
And we're learning, I hope we're learning anyway, how to, through antibodies or whatever as time goes by, how we can be tested. Because I'd like to know.
Sure.
Because, and you've been around a lot of people too. Mm-hmm. I haven't been sick at all. I feel great. But I don't know.
Yeah.
And, when you see a picture that was taken at the thing in Tulsa and you see Herman Cain, if people are familiar with Herman Cain, he ran for president. He has a radio show. He was sitting right by the governor and not wearing a mask. And he was in the hospital last week.
Yep.
And so, doesn't mean everybody around him. Now, and Jim Inhofe was right by him, right behind him. He was behind him in that thing, but there's no reason to think he didn't turn around and shake his hand. Sure. He's a U.S. senator. And so there you have an 80-something-year-old man probably shaking hands and interacting. Doesn't mean he's got it.
No.
But I would say he's been exposed.
Yeah, and I think, the level of precaution being taken at events like that is disappointing because of that issue, right? Both from the personal responsibility of am I doing what I need to do to keep myself from getting sick, and also from the outward faced responsibility of am I doing what I can do to keep others from getting sick, and I think that's the two-way street here. I get a lot of comments. Well, I shouldn't have, I should be able to choose to wear a mask because those are my personal health decision. It's not your personal health decision. It's not. That is, I mean, we've been trying to make this point. Everybody's been trying to make this point. A lot of people have been trying to make this point for a long time. Wearing a mask is not about your personal health decision. I don't care if you personally get sick. I'm not concerned about one individual person getting sick. I'm concerned about you getting 5 other people sick, right? And those 5 people getting 5 more people sick. So it's a mindset change from I'm not just worried about protecting my own personal health, but I'm worried about protecting the health of the community, and my actions have an impact on the community, and so I need to change my behavior to address that.
Okay. Well, while we're on this topic now, let's talk about what's going on tonight and what may be down the road, because our numbers have increased. There's no doubt that we've had a surge.
We have since the beginning of June, absolutely. At the 1st of June, we had 22 cumulative cases and 0 active cases in Stillwater. Today we have 373. I was going to pull up my latest numbers. Yeah, total cumulative 373, 85 active here in Stillwater. So that's a big jump in just over a month. That's a lot of new cases. Thankfully, we haven't seen deaths locally from those new cases. Thankfully, we've seen a relatively low burden on local hospitalizations with those new cases. That's all good. It's all partly the responsibility of the fact that a lot of these new cases are in a younger, less vulnerable population at this point. But that is what we've seen in Texas with their spike, is that it starts with younger, less vulnerable populations, and now it's becoming more and more cases that have becoming hospitalized, and they're seeing problems with their health systems because of those hospitalizations. So a lot more cases. The growth trend has slowed down a little bit over the last week or so. We were seeing 18, 19, 20, 25 new cases a day there in the middle of June. The last week or so, we're seeing below 10 most days. I don't know how it's really hard to interpret that data and say, oh, it's slowing down, we're going to be okay. Or we did a lot of testing when football players came back, when a few students tested. We tested a lot of people at different businesses when they closed down. So there was a lot of new testing happening in June, not near the rate. The positivity rate was much higher. So it's hard to say with it slowing down right now what that means. We are still concerned about the growth, still concerned about long term. I mean, I think the other difficult thing to take into consideration right now is to say, well, it's one thing to worry about what's happening right now. It's another thing to plan for what's going to happen in August and September and October. And so we're considering a mandatory mask ordinance at the city council meeting tonight. It's been discussed back and forth for a long time, and decided we just need to put it on the agenda and solicit public comment. I've gotten tons and tons of emails and calls and social media messages about it, and I know the other councilors have as well. And so we're going to talk a little bit about that ordinance tonight and determine what we want to do with it.
So tell me the steps that this would be. Now, first of all, people can come and speak tonight, right? If they want to?
Yeah,
okay.
They can come. I will be physically in the chambers tonight for the first time in a few months. The rest of the council will still be remote. You can come speak in person in council chambers. You can also sign up to speak online, speak via the Zoom. The meeting will still be on Zoom. You don't have to come physically if you're concerned about that. We will ask you to wear a mask if you come into the city council meeting tonight. But you can sign up to speak either way. You can speak in person or you can speak via Zoom. We'll send you the link and everything. So you just need to get on the city's website or call the city manager's office and tell them that you'd like to sign up to speak if you want to. So what
are the steps that let's say one way or another? Let's say that you guys discuss this and you're leaning toward mandating mask wearing, if that's a sentence. It is nowadays.
It's one, yeah.
What would be the next step?
So with any ordinance, it takes 2 readings to pass it. So it takes, if we read the ordinance tonight and vote to advance it to the second reading has to take place on a different day, which is a somewhat unique in Stillwater City Charter. Other cities you can do both readings on the same night, but so that we'd have to do it on another day. So normally what we do is we wait till our next scheduled city council meeting, which is usually 2 weeks away. This month it's next week, but we could also call a special meeting and read it again sooner if we wanted to, because you got to do that second reading to make the ordinance effective.
So if you wanted to do it on Wednesday, you could.
We could call a special meeting faster, and if it's clear we want to move forward with however the ordinance ends up after the discussion tonight, we can do that. Or we may wait. It just sort of depends on what the situation is. If we have some changes or we want to see it modified in some way, we may give staff some time to do that and come bring it back in a week. So there's a lot of different ways it can happen. I mean, the way this is set up right now, is very much modeled off what we've seen in other states and some other cities.
Would you be, for instance, Kansas? Which they surprised me. They went a week and a half or so, and they just made it is a regulation there. I mean, you have to wear a mask in Kansas. That surprised me. But would it be better if the whole state does it rather than city by city?
Absolutely, it would be better. Absolutely, it would be.
As the mayor of a city, sure.
I mean, it's just, I have no problem standing up and saying that. I mean, I think one of the things you and Michelle talked about this morning too is, kind of everybody wants somebody else to be the bad guy in these situations, right? And to a huge extent in Oklahoma, that's been the mayors, that's been the cities that have had to be the ones that step up, because the state has not taken the lead on putting the restrictions in place. But I mean, like I was saying earlier, this is not a local virus. This is not just a sickness that people in certain places get. It is widespread. It's all over the state. Our population is extremely mobile. Students, non-students, everybody. There's lots of people that go out of town to shop. There's lots of people that go out of town to go for entertainment, to go eat. So the idea of a mask ordinance makes much more sense if you're talking about it on a wider context than you're talking about statewide. And I was surprised and I think pleased to see both Kansas and Texas go to statewide orders. I know New Mexico is already in a statewide order, I think.
Could you notice the difference?
When I was in New Mexico, we went to the grocery store one time. Everybody was wearing a mask. I mean, they just were. In fact, the grocery store that we went to one of the grocery stores we went to had like a person standing outside who was just, I guess reminding people, but nobody needed reminding.
Right.
But there was clearly there was some leeway in terms of how that was being enforced, right? I mean, not every store had people standing out in front of it saying you can't come in. And that way this ordinance is written is sort of modeled off what we see in those states, which is to say that businesses are not being asked to, force people to stay away. They can, if someone comes in without a mask or refuses to leave without a mask, that the business has the ability to call the police, which is basically a trespassing complaint. In fact, that's the case now, right? We have several businesses in Stillwater now that require masks to come in, and if someone were to refuse or to refuse to leave because they didn't have a mask on, those businesses absolutely have the ability to ask the Stillwater Police Department to assist with a trespassing complaint. That is the case now. So this really wouldn't change that much, other than saying that all businesses now need to post the signage that says you have to wear a mask to come in. If people don't, now it doesn't force them, right? I mean, there's very little coercion in this ordinance, and that's one of the I think the concerns I have with it, which is just that it's kind of yes, we're mandating masks, but we're also not putting a whole lot of teeth in it to force people, right? There's no we don't want. It makes very little sense for me to say the Stillwater Police Department is now going to be running around writing tickets for masks. They've got all kinds of other stuff to do. We certainly don't. I don't love the idea of 50 people calling up a day and reporting somebody they saw in Walmart not wearing a mask. And I mean, it just creates administratively and practically such a tremendous burden on a police force that is already busy doing its job, right?
Yeah.
And
I think Missouri is where we are on that. It seems like I think most of Kansas City is now.
St. Louis too.
St. Louis has now
St.
too.
Louis County just put one in place.
Okay, I hadn't seen that, but St. Louis and Columbia, which I was interested in Columbia because you're talking about another college town.
Towns.
And so they had seen the same, and it's a little bigger town than Stillwater,
Yeah,
but
it is.
the university's about the same size, and they also seen a surge. So Columbia was in early on. I didn't know St. Louis had.
Yeah, just recently I had a text from some friends in St. Louis today, actually asking about their local ordinance. But yeah, you are seeing that certainly in some bigger cities. Our local big cities, Oklahoma City and Tulsa, put in some newer, kind of walked back a little bit partway to phase 2. They put back their bars to 50% capacity. Yeah. They're requiring masks of employees in those places, which we had in our phase 2 orders as well. And I think I can't remember, they did something else, which is, it's a struggle right now to try to figure out what's the best way to do it, right? Because a mask ordinance, if you just do masks and you say, let's, from what we can see in the numbers, it helps reduce transmissions. And if we can get it slowed down like that without having to put more business restrictions in place, then, I'd prefer to do that. I'd prefer to put masks in place. We've had these conversations with businesses around town. Justin at the Chamber has been doing great work to try to talk to some folks and just say, hey, it looks like if we can get more businesses to keep people in masks, then maybe we don't have to step back to the actual restrictions on business.
Any word on the bars? Since you mentioned bars, and I don't know what ours look like right now. If you went down to the Strip, I don't know if it's wall to wall or not.
It depends. It has been certainly in some at some times over the last few months. Certainly when they first opened, when we reopened them, they were packed. I've had a couple of conversations with local bar owners who I think are trying to do the best they can to be conscientious and to follow guidelines, and they've done all of the take away the reusable kinds of things. They're using plastic cups. They're
Right.
throwaway cups. They took out all the shared kind of facilities or condiments or that kind of stuff that they might have, and they're disinfecting regularly, all that kind of stuff. They're working to try to keep the transmission low, but they also say, hey, I don't care if you have half capacity or full capacity, everybody in the bar is going to be standing next to each other.
Yeah.
Right.
That's why they went to the bar.
That's why they go to the bar. Yeah. You go in and you get in a crowd and you drink and talk and yell at each other. And, that's what it is. That's why people go. So it's, at 50% capacity, maybe you're not getting quite as many people in there together. But if you're at 50, if you're talking about the Strip in Stillwater and all your bars are at 50% capacity, are you really actually are half the people who would have gone to the bar that night just not going to the bar, or are they just going to a different bar then and coming over to the next one? And it's from a practicality standpoint, from an actual effect standpoint, it's hard to know how much that really helps. Closing them would certainly remove that as a method of transmission, but that's something we really would hope not have to.
It's a last resort.
Yeah, absolutely.
Yeah.
So, that's I think my personal standpoint on this is masks work. I'll say it this way: the CDC, the State Department of Health, the Payne County Health Department, the World Health Organization, at every level, every public health organization is recommending that people wear cloth face coverings to help reduce the transmission of COVID-19. I'm not a epidemiologist. I'm not a doctor. People are sending me studies. They're sending me, and trying to make some argument that the CDC's wrong or the CDC whatever. I'm not interested. I'm not reading all. I've looked at stuff and I've read and I understand that there are people out there who are making those arguments, but my job is to be the mayor, and the CDC's job is to be the CDC, and the State Department of Health's job is to be the State Department of Health. These are professional epidemiologists and public health officials who have studied and worked, and they do not have an ulterior motive other than the protection of public health. I'm not. If you think the CDC is corrupt, if you think the State Department of Health is in some sort of conspiracy in order to force you to get a vaccine or to force you to have a chip implanted, I'm sorry, I don't believe that. I don't believe that's true. I am not going to make decisions based on the idea that somehow these public health organizations, whose job it is to keep our community safe, are somehow, part of some global conspiracy. It's silly. It's absolutely silly, and it's not something that
And if
will
you go
come
to a
into my
site, though,
decision making.
and they can get a few hundred people on that thing,
Yeah.
it explodes.
It does.
I mean,
Social
you can
media
almost
makes it-
convince people the Chiefs didn't win the Super Bowl last time. I mean, there might be a site that says that, and this was a staged game and all this stuff, and there would be some people believe it.
I mean, it's just
Patriot fans probably.
Patriots haven't lost in 10 years.
That's right.
Yeah, I mean, it's unfortunately very easy to spread that kind of misinformation, and I think people, those conspiracy theories, I think people want to believe there's some order to what's happening, right? Because right now our world seems very chaotic. There is just, who knows what's going on, right? I mean, we talked about it. The doctors are still learning. That people are still learning. They're trying to figure out what the heck is going on. What's the best way to do this? Governors are changing their minds. I mean, it's a very chaotic place right now, and a conspiracy theory of some kind gives you a little bit of order. It makes it a little bit easier to understand. Well, I mean, it would make sense if there was somebody behind the scenes pulling strings here. That would give me a little bit, at least I don't like it, but at least it's order, right? At least it's understandable. And I think that's the problem with those kinds of theories, is that they prey on people's desire for stability. Right? Even if it's bad stability, at least it's not chaos. At least it's not, random. But the world is the world. Like, the idea that you could coordinate that kind of conspiracy through that many levels of government. I mean, it's funny to me that people complain about the ineffectiveness and the sort of government's inability to get things done, but then could also hold the theory that these government agencies are somehow capable of conspiring with each other over the course of several years at several different levels to put this stuff in place. I mean, it's craziness.
Stay away from those sites.
Yeah. So all that to say, the CDC, all the public health agencies, the state, the county, you should be wearing a mask. You should be wearing a mask. There is no other way to say that. Unless you have a specific underlying health condition that is identified as one, or you're under the age of 2, you should follow the CDC guidelines and wear a face mask. So my job, or our job at the City of Stillwater, is to figure out what is the best way to do that. How do we get the most people wearing masks? Is it to pass an ordinance and make them? Maybe. Is it to work with the business community and try to bring it along and do it in a less, coercive sort of a way? Maybe. Is it through education? What is the best way for us to do that? So I'm not entirely sure this ordinance is definitely the best way to do that right now, but we're going to talk about that, right? Because at a minimum, getting more people to wear face masks is incredibly important for us to slow the spread of this disease. If we can do that in whatever way we can do that, is the way we want to do that, right? So if it's a mandated order, then we'll mandate an order. Because
we want to have a football season.
We want to have a football season. We want to have students on campus, right? I mean, football season happens if students are on campus. You're not going to have a football season. You're not going to have students taking classes remotely and also still have a football season. Like, that's not going to happen. So, and students on campus consistently for the fall semester is way more important than just 6 football games, right? So the students need to be here. They need to be safe. We need to be controlling the spread, and we need people in Stillwater.
I saw a little meme that said, to tie this to sports a little bit, it was quoting Yogi Berra, and it said, in order to not have deja vu all over again, Yogi wore a mask. He was a catcher.
He was.